Let us take this report from our correspondent Emmanuel Audu, as you also join us on all our social media channels by following us and sending your questions and comments with the hashtag COVID 1 year on.
The COVID-19 pandemic in Nigeria is part of the worldwide pandemic of coronavirus disease 2019 caused by severe acute respiratory syndrome coronavirus 2. The virus, which originated from Wuhan in China at the end of 2019, has infected over 113 million people and led to the death of over 2.5 million worldwide. The first coronavirus case, which was announced in Nigeria, was on 27th of February 2020 when an Italian citizen in Lagos tested positive of the virus. On the 9th of March 2020, the second case of the virus was reported in Ewekoro in Ogun State of a Nigerian who had contact with the Italian citizen. Since then, the number of the cases in Nigeria have grown, with Lagos being the epicenter of the pandemic in Nigeria. On the 3rd of March 2020, the country recorded a first death. As a way to coordinate and oversee Nigeria's multi-sectoral intergovernmental efforts to contain the spread and mitigate the impact of COVID-19 pandemic in Nigeria, President Muhammadu Buhari on March 9, 2020 inaugurated the Presidential Task Force on COVID-19 headed by the Secretary to the Government of the Federation, Boss Mustafa. However, it is heartbreaking to note that some prominent personnel have been killed by the disease. Efforts by the World Health Organization and Federal Government of Nigeria to contain the spread of the virus includes wearing of face masks, washing of hands with soap and water, and the use of sanitizers, social distancing, phases of lockdown which led to interstate travel ban. Offices, clubs and services considered to be non-essential were closed. Meanwhile, one of the major response from government is the 500 billion naira COVID-19 Crisis Intervention Fund and enhanced support to states for critical healthcare expenses. No doubt, COVID-19 pandemic in the country affected the livelihoods and food security of smallholders, especially poorer households. However, the Federal Ministry of Humanitarian Affairs, Disaster Management and Social Development was tasked with implementing palliative measures across the country. Some include the disbursement of 4 months grant of 20,000 naira to the poorest household in various states, donations of food items to the government for onward distribution to citizens. It will be recalled that on the 10th of December 2020, the Secretary to the Government of the Federation, Boss Mustafa, said the second wave of the pandemic has begun following the increased number of COVID-19 cases detected in the country. As Nigeria and the world at large becomes more disturbed with continuous increase of COVID-19 death cases, World Health Organization, in partnership with scientists and global health organizations, commenced work on producing vaccine in order to provide acquired immunity against severe acute respiratory syndrome coronavirus 2. It will be recalled that earlier this month, 10 vaccines were authorized by at least one national regulatory authority for public use, while Nigeria's National Agency for Food and Drugs Administration Control approved the Oxford AstraZeneca vaccine for use in the country, as the vaccine is set to arrive in the country in the next couple of days. Emmanuel Audu reporting for Moneyline with Nancy.